Namaskar, this is Dr. Chitra Setya. I'm a senior consultant obstetrician and gynecologist at Apollo Hospitals, Noida. This happens to be the Cervical Cancer Prevention Week, so it's very important for us to educate patients and the general public on what is cervical cancer and how can we prevent it. Now, cervical cancer, cervix is the mouth of the uterus, which projects into the vagina. And as far as women are concerned, the vagina, the throat, and the urinary tract are the most important causes of infection. And what are the risk factors of cervical cancer? The risk factors are early marriages, multiple pregnancies, early sexual age, multiple sexual partners, smoking, and poor perineal hygiene, malnutrition, which decreases the immune system, no cancer vaccination prevention, and also HIV. Now, in the 2020 census, the incidence of cervical cancer was as high as 6 lakhs, and there were about 3 lakh deaths. And maximum was in the low and middle income countries, and India was among the maximum numbers for cervical cancer. And why does this all happen? Because of a lack of education, lack of screening, and lack of vaccination. Now, how can we prevent cervical cancer? The primary thing is limiting the number of partners, limiting the number of children, at least counsel our teens to have, not have sex very early in life, and use preventive techniques while having sex, and timely treatment of reproductive tract infection. Now, one very important thing is people should understand when to go for examination. So, primary treatment is treatment of any vaginal infection. Go to a doctor when there are repeated vaginal infections, repeated pain abdomen, or bleeding in between periods. Because the early stages, there are no other symptoms apart from these, and very minimal testing can be done to cure this and prevent any further development of cervical cancer. Then is the cancer vaccination. This is a very, very important thing. And in the Western world, cervical cancer has almost been eliminated by the persistent use of vaccination from childhood onwards. The WHO guidelines say that we should give the cervical cancer vaccination starting from the age of 9 to 14 years when the children are not sexually active, so that their immune system is better. They have a vaccine for the prevention of HPV, so that the HPV immune system is strong enough so that even if they get HPV infection, the body can react to it. 9 to 14 years, they have the cervical cancer, which is given in 2 doses. One dose maybe on day 1 and the next dose after 6 months. After 15 years till 45 years, 3 doses are given. One, then after 2 months, and then after 6 months. Nowadays, India, the Serum Institute of India has made the vaccine called Cervavac, which looks after 4 vaccines, which 4 viruses, the 11, 16, 18, and 9. And that prevents the genital warts also. So we don't have to depend only on foreign vaccines, and this is working out much cheaper as far as our population is concerned. Secondly, screening is very important. Just taking the vaccination does not mean that it's 100% prevention of cervical cancer, and screening by the simple pap smear should be done starting from the age of 30 years. And for those who have HIV, it should be started from the age of 25 years, because those who have HIV are 6 times more prone to develop cancer cervix. The other vaccination is a 3-dose, and nowadays for the youngsters from 9 to 25 years, there is the nanovalent vaccine, which covers all 9 viruses. So all of genital warts are prevented, even the very rare viruses of HPV, which cause cervical cancer, which can lead to cervical cancer, are taken care of. It is slightly expensive. It is about 10,000, but for younger children, it is very, very important to spend that much so that their life is protected later on. Now, don't think that HPV vaccine means no screening required. No. HPV vaccination prevents the formation of HPV or transformation into cervical cancer, but it is not a 100% guarantee. It improves the immunity and everything, but it does not prevent it. So screening has to be done. And according to the global guidelines, it says that ideally there should be a screening at around starting from 30 every 5 to 10 years. And at the age of about 35, they should be screened specifically for HPV, which costs slightly higher, but one screening for HPV at 35 years and 45 years will take care of quite a few of the incidences of cervical cancer. Otherwise, they are to be screened every 3 years with a simple pap smear. And in the villages, we even say the Ayush people can just apply a plain acetic acid, the VIA test, the vaginal installation of acetic acid. If there are any white areas, a biopsy can be taken and any cancer can be treated. And initial any abnormality with the pap smear or the HPV positive, there are very, very simple treatments which can be done in the OPD itself for prevention of cervical cancer later on. And even if cervical cancer is developed, they should go to an onco center and prevent it and treat it, because it is still treatable if diagnosed. What happens with our country is that most of the cases are not diagnosed, and that leads to a delayed death. And no cervical cancer it takes a good amount of time after diagnosis initially to proceeding to cervical cancer. So it takes a good 15 to 20 years. So in the early stages, if they are picked up and treated, that does not develop cervical cancer. So please educate your family, give vaccination to your children, and counsel others also to get prevented with cervical cancer vaccine. Thank you. Namaste. That should be enough.
ठीक है मैम, मैं इसका ना भी डाउनलोड करवा के ना आपको भेज देता हूँ। अगर आप ओके कर दोगे तो मैं क्रिएटिव बना के कल परसों में लाइव कर दूंगा।
Hello.
Hello.
Yes, ma'am, it's done. Thank you very much for your time.
डाउनलोड करके दे देना, फिर मैम का अप्रूवल ले लूंगा मैं।
ठीक है यार, जैसा भी हो, as long as you all think